Hi, my name's Matt May. I'm KC4 WCG and the project manager for a program called KC Heart. That stands for the Kansas City Hospital Emergency Amateur Radio Teams. So today with me is Carolyn Wells, who's one of the co-chairs of the Kansas City Regional Hospital Committee. And we're going to give you an overview of how this project came to be and its value not only to hospitals but to the community as a whole. Carolyn, can you give us an overview of the hospital project?
Well, I thought I'd start first with a history
Excellent.
of amateur radios and why they belong in hospitals. It actually started with Katrina. There was, of course, as you know, we had Hurricane Katrina, and there was flooding in downtown New Orleans, and that affected one of the HCA hospitals, Tulane University Hospital. The way that they were able to evacuate their facility is they had amateur radio operators who were flown in from the corporate office in Tallahassee to help coordinate the evacuation. They set up their long-distance radio, their HF radio. They coordinated the helicopters coming in to evacuate people, and they stayed there on site until the last patient and staff member had been evacuated. They were the last people to leave. Their value was widely touted. There was a book written called Leave No One Behind that details how that evacuation was done and really highlights the amateur radio operators that were involved. What this did is it set an example for the Joint Commission, and Joint Commission said you need to have redundant communications within your facility so that if all communications go down, you still have a way of communicating not only with other hospitals but with the community in general. So they suggested that you put in amateur radios. Matt, do you want to talk about how we decided to do this in the Kansas City area?
Sure. We designed a project, Carolyn in her role with the hospitals, and then with me as a technology projects manager for a group called the Mid-America Regional Council. That was my employer at the time, where my job was to put together technology projects that were to support the public safety and public service community, response community, and this fit us perfectly. My amateur radio background and my past experience with it and my connections with the amateur community in the Midwest area really helped to bring this together. So one of the big scope problems was to decide what we wanted to accomplish with this and how we wanted it to work. So the first thing really we had to do was identify who the leadership was going to be. So Carolyn, being the project director, and was our funding source, always good to have one of those. I took on the technology project management, and then we brought in some subject matter experts like Brian Short, who you will see in some of these other videos, helping us out. He's been a great resource for us. Between the three of us, we architected a plan for putting amateur radio equipment in fixed locations in each facility, not only in just, as it turned out, the metropolitan area, but all of the Homeland Security Troop A area of Missouri. Turned out to be a very large project. A lot of work because each facility was different. Take a lot of working with the hospital administration and the facility managers to make sure that we did this in the least invasive way possible, the most effective way possible for their operations.
Matt, do you want to tell us about the capabilities that each hospital installation has?
Sure. To line all that out, we took a look at what we really needed to do. Do we need to talk hospital to hospital? And the first answer there was very much yes.
Absolutely.
Yeah. And the second question then is what kind of long-range communications resources did we need? At that example, for example, the HCA company is based out of Nashville, and could we reach back into their corporate headquarters to request resources if we had a large-scale communications outage? Well, it turns out we were able to do that using kind of a hub-and-spoke network, where some facilities had that long-distance capability and others just had the local capability, or what we refer to as VHF and UHF capabilities. We wanted for sure to be able to talk within the metro to each other, and we effectively were able to do that not only with voice communications, but also because we've become so reliant on data communications in this day and age, we wanted to make sure we could replicate that as well.
I know that there were a lot of challenges when you're installing in hospitals. Some of the hospitals are private, some of them are nonprofit, some of them are for-profit, and so there are many challenges that we had to overcome in installing. Do you want to talk about some of those?
Sure. the biggest key there, again, as I alluded to earlier, is every facility is a little bit different. Some have different configurations to be able to put antennas on the roof. Some didn't want any antennas at all. This project kind of necessitates that. So how do we put those up without disturbing the architectural features of the facility and yet be able to put that equipment in permanently? So where we were able to install it varied all over the place. Some places it was in a cabinet in a boardroom where their emergency operations center was to be held. Sometimes it was just for logistics sakes at the highest point in the building so that they were closest to the rooftop to minimize the cost of the installation. Some required different HF antennas, so we ended up buying 2 different variations there. But the other parts of it, the kinds of radios we had, were standardized across the board so that every operator was trained the same way and they could use the same equipment and could support each other and provide mutual aid from one facility to another with little or no impact for which facility they were at. So all of those were considerations at each and every installation site. We were able to find one contractor willing to deal with all those variations for installations and make sure that they were done safely, but yet in an effective way.
Part of the funding that we got for this project was from the ASPR funds, from Missouri side, which are the hospital preparedness funds. These funds are also helping us sustain the capabilities that we have. Each hospital is now responsible for maintaining those radios, but we still go in and we do maintenance on them and
Absolutely.
make sure that they are programmed correctly. So currently, we have 46 facilities that are participating in Casey Hart. This includes acute care hospitals. We have a couple of our public health agencies that are participating. We have some of our long-term care facilities that participate. We have some kits that are available in different areas that people can also utilize. So this project has expanded and is now all over Kansas City metro area, including the Kansas side. Also, as Matt mentioned earlier, Troop A, which is 13 counties outside of the MARC region, are also involved in this project. It's been very worthwhile, and we're one of the few areas in the country that have actually done this.
Correct. There have been several areas like St. Louis, for example, that have emulated what we've done. Their implementation might be slightly different, but their concept was the same. And maybe, Carolyn, you can speak from the hospital side and talk about the value to the hospital to have these kinds of communications. Under what situations do you envision it being used, and what kind of comms would you expect from these folks?
Well, here in the Midwest, we don't have hurricanes, but we do have other things that might impact our communications. We may lose complete network viability, which has actually happened at several of our facilities. So that certainly is a very believable scenario, where you're not able to use any of your computers or phones at the hospital. Even though cell phones might still work, cell phones inside a hospital do not work very well. So amateur radio could be used to help provide that secondary communication until we can get our systems back up. Because of the digital capabilities that we have, we can send information digitally to other facilities.
Would that help with forward movement of patients, that kind of record keeping?
Correct. We have a computer system within the metro that we have up in all of our emergency departments. And so this system allows us to replicate that information and send it digitally to other hospitals so that they know what capabilities we have, even though we can't talk on the phone or on our computers.
Now, other examples that we've done before are blood requests, tracking patients as they're moving from one facility to another during that forward movement to try and relieve the pressure off of an area that's impacted. We've simulated and run exercises here in the metropolitan area many times using various scenarios to try to replicate what those scenarios might look like to us and what impacts they might have to the hospital, and then make sure that this amateur radio capability could be an effective tool for either replacement or augmentation of existing systems.
Correct. There may be times when all of our systems are up, but we need another way of communicating with emergency management or EMS or fire. And this is one of the ways that we can do that.
One of the last things I'd like to share is that there's a huge support for this project from the amateur community. just to staff the facilities that we have takes almost 100 volunteers, and truthfully, we could use another 100 to have a good bench depth, if you will. So we're always looking for more volunteers, managing that turnover because they come and they go. Making sure that we've got enough staff available to staff all the facilities is really a critical role that we still work very hard to try and maintain. So it's another resource of personnel as well as hardware and assets.
And that concludes the overview of the Casey Hart project.
Thank you for your attention.